All right, we are live.
Hey.
Hello, Facebook family and friends. How are you? It's Dr. Janine here. I'm here for a special series called Weight Loss Expert Series. I have a special guest here, a fellow weight loss expert, Dr. Vanessa Jeffers. And before she introduces herself, let me, I haven't been on for a while, so maybe you've already forgotten who I am. But I'm Dr. Janine, your board certified family doctor and weight loss specialist. I help women get their sexy back by providing a comprehensive weight loss program. And also, I'm the owner of Lifestyle Changes, which is a virtual medical practice in Pennsylvania where I specialize in medical weight loss as well. Also, recently, I became best-selling Amazon #1 author of Get Your Sexy Back, a guide to bouncing back after pregnancy. So here we are today. We're going to be sharing this week about several things, topics for weight loss, and hopefully this will help you get your summer body ready and also maintaining that body as well. So here we are, Weight Loss Expert Series, and our first guest is Dr. Vanessa Jeffers, and we'll be discussing balancing your blood sugar. So Dr. Vanessa, introduce yourself to everybody here.
Well, hello, Dr. Janine. Listen, first, I have to say thank you so much for inviting me to be a guest here on your show. It's truly an honor to be here and share. So, I would like to say hello, everybody. My name is Dr. Vanessa Jeffers. I'm your board certified internal medicine physician and certified weight loss and wellness coach. So, I help women who have struggled to keep the weight off, successfully slim down, and really truly get the lifestyle they desire. And I do that through a comprehensive weight loss program. And so thanks for having me here.
Okay, thank you. Thank you. All right, so let's jump in and please share your comments. We will be answering questions as well. So if you have any questions, put it in the chat and we will, um, answer all your questions. Hi, Dr. Kadisha. Thank you for joining us this evening. Thank you for sharing our live as well. All right, Dr. Vanessa. So let's jump into it. So
Okay.
when a patient comes to you or a client comes to you, they're like, I need to lose weight like ASAP. Um,
Mm-hmm.
the first thing is, as medical doctors, we definitely need to know their medical history and know their family history and, a little bit more about why they want to lose this weight. And then also if there's any chronic diseases and everything. So, how do you measure or do you check labs prior to these clients coming in or patients? How do you measure like their blood sugar since we are talking about blood sugar?
Mm-hmm.
Yeah.
So blood sugar is one of the key things that I look at. And basically, the main way we're looking at blood sugar is with the hemoglobin A1C.
Mm.
So, and that I love that test because it gives me a great idea of what's really going on.
Mm-hmm.
So, when I first was training, we used to just do, random blood sugars or have people come in for fasting blood sugars. And then we also did the test, like a glucose tolerance test.
Okay.
But this is basically um, a better test because it gives me an average of what's going on. It gives me a better snapshot on what's really happening.
Mm-hmm.
And so it's called the hemoglobin A1C. Some people may know it as a glycohemoglobin or glycated hemoglobin.
Mm-hmm. Okay. All right. And so, like, I know some people will say my range is like 5.6, 5.7,
Mhm.
which we get concerned for,
Right.
pre-diabetic. So, what range do you start, saying, telling people, we need to do something, about that
Right.
weight, check this number again.
Right. So I always show them the labs and I go through it in detail.
Yeah.
so many patients I've come across have met doctors who really didn't go over it with them. So they may say, oh, you're borderline, but they really have no understanding of what that means.
Mm-hmm.
So with the hemoglobin A1C, the normal range you will see is less than 5.7. Okay.
Right.
So if you're, 5.5, 5.6, that is read as normal.
Mm-hmm.
And for diabetics, we're looking at people who are 6.5 and above, right?
Mm-hmm. Yep.
Now, if you're in that in between, that 5.7
Mm-hmm.
and 6.4, that is what we're now calling pre-diabetic.
Right.
Okay. So, before people would say, oh, I have borderline diabetes, I have a touch of sugar. They say different things, right?
Right. Touch of sugar. I got the sugar.
Like, yeah. But basically, what we're saying now is that we're saying that that in between is pre-diabetes.
Right.
And so to me, that is a great that in between you can do so much with.
Exactly.
There's
Exactly.
so much that can be done at that point. But that's typically what the numbers mean.
Mm-hmm.
And sometimes people want to know, well, how does that number come about? And so I'll just tell you quickly that
Yep.
the A1C is it has to do with our red blood cells,
Right.
right?
Yep.
And the blood glucose. So we know as physicians that the lifespan of the average red blood cell is about 120 days.
Right.
And when a new blood cell comes out into the bloodstream, it's basically free of glucose.
Mm-hmm.
And so as that blood cell, is circulating in the body, just living in that bloodstream, it is like absorbing, glucose.
Yes.
And so they're able to use that as a measure. And it gives us an idea of what your blood sugar has been on average for the past, or I would say the prior 8 to 12 weeks.
Right.
And that's how we use that.
That's right. Okay. Thank you. And then, so with the elevated or the pre-diabetic range, um, if a patient does not know how to balance that sugar, what are your recommendations, and what are their risks if they don't get their numbers under control?
Yeah. So my experience has been when I see that pre-diabetes scenario,
Mm-hmm.
that often this is a patient who is overweight
Mm-hmm.
or even obese.
Mm-hmm.
And one of the things that my first recommendation at that point is lifestyle modification.
Right.
And a cornerstone of that lifestyle modification is really going to be weight loss.
Right. That's
And
right.
so weight loss, diabetes, pre-diabetes, sugar, it's almost like two sides of the same coin.
Right. Exactly. That's
right?
right. Mm-hmm.
And so I really recommend looking at the weight. Sometimes it's a very touchy, sensitive topic.
It is. It
to
is.
bring up, right?
Yeah.
But
Yeah.
I do it. And so when I'm speaking with my patients or clients, we're looking typically at a BMI chart,
Mm-hmm.
and I'm showing them, based on their height and their weight, where they fall,
Mm-hmm.
and really what this weight kind of translates into.
Yes.
And I find the weight is one of the I want to say, let's see, one of the area where you could kind of focus
Mm-hmm.
to really turn everything around. If we can just kind of focus on that, we can turn around a lot of things.
Of course. Of course.
A lot of things.
Like your high blood pressure, your cholesterol, all of it, right?
Yeah. Decrease your risk of all of that.
All of it. Yes. 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 So when you get a weight loss patient and they do have pre-diabetes, or they are diabetic, some of them are diabetic as well. How do you what are your recommendations in treating their blood sugar levels?
Okay. So if we get back to maybe like nutrition.
Yep.
So one of the things that I like to do, I do tell the patients. Some
Mhm.
people, their first idea is, oh my God, I gotta go start working out. I gotta go hard at the gym
Mhm.
and work
Yep.
out.
Nope.
And I let them know right away that
Yes.
really it is, I would say 80%
Yeah.
nutrition and probably 20%
80, 80,
exercise.
80, 80.
I'm sorry, what that's eight, okay. 80%,
80%.
80% nutrition
That's right.
and 20% exercise.
That's right.
Okay.
Mhm.
And people tend to, for whatever reason, they want to do the opposite.
Right.
They think that they have to go and exercise,
Mhm.
and then the little bit's going to be the nutrition point.
That's
So
right.
we kind of start there. If
Mhm.
someone does come and they're diabetic and the A1C is high
Mhm.
and they're having symptoms,
Mhm.
well, that person, we're going to be talking about medication like right off the bat.
That's right. That's right.
But many people, we can really start without medication.
Mhm.
We can start with that lifestyle modification
Mhm.
and start with nutrition. So nutrition wise, again, I like to look at it as balancing the sugar.
Mhm.
All right. So the first thing people say to me, well, Dr. Jeffers, what am I going to eat?
That's right.
I don't know what to eat.
Yeah. Dr. Kadisha's in here. She's cracking me up. She's making a lot of comments. She said, we want to eat.
She's right. She's right. But a lot of times people, I've seen sometimes that people are not eating enough.
Right.
Right. And then I see that sometimes people are eating a lot and it's all the wrong things.
All the wrong things. Yes.
Right. So we have to kind of come together on that.
Yes. Come to Jesus. Come to Jesus.
Right. Exactly.
Yeah.
So one of the things I like to start people out with is actually telling them that they need to eat breakfast. So many people do not eat breakfast.
You're right. You're right about that, Dr. Vanessa.
They have to eat breakfast. And then also I like to have and the thing is, a lot of times the patients have heard this before. So what I'm telling them often is not new. I will say that it's not new, right?
Yeah.
But they want to eat. You want to eat breakfast, but then you also want to eat like 5 to 6 small meals throughout the day, right?
Mm-hmm.
I know some people, their claim to fame is, I only eat 1 meal a day.
Dun, 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 dun.
Right.
Right.
And that's the problem.
Yes. 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 Yes.
Right. So if you can, there have been studies that showed that there were people who had the same amount of calories, right?
Mm-hmm.
And it was split up into 5 to 6 meals.
Mm-hmm.
They actually lost more weight than people who ate the same amount of calories in like one sitting.
Yep. Tell them, Dr. Vanessa.
Yeah. So you need to split it up into 5 to 6 small portions.
Yeah.
Small portions.
That also increases your metabolism too.
It does. Yeah. And what I try to explain is like, imagine you're in your house, okay? It's winter time, and you're not going to put on your furnace until what, 2 p.m.? You're going to freeze all day. You put some fuel in that furnace, or you turn that furnace on in the morning, it's going to keep you warm all day long. And so that's why breakfast is important. And that's why putting, just fueling that furnace all day, it helps you burn calories. It keeps your metabolism going.
Yes. So there's a question here from Dr. Kadisha in regards to intermittent fasting. So since we're talking about these 5, 6 meals a day, how do we, intermittent fasting is not for everybody.
Right.
And then, we're talking about balancing our blood sugars and our pre-diabetic versus, and diabetics and everything. So it may not be a good option for these people. But I don't know if you want to touch on that a little bit, if you're comfortable with that.
Well, it's not something that I have really done myself. And I do know that some people do very, very well with it.
Yeah.
But it's not something that I tend to recommend.
Yep.
Yeah. to
Yeah.
my diabetics or
Right.
pre-diabetics.
No.
Because I mean, we're looking at something that you want to be able to have a sustainable lifestyle.
Mm-hmm.
And like you said, it's not for everybody.
That's right.
Yeah,
That's right.
it's not for everybody.
Yeah,
So it's
because I
not
know
something
it's the trending thing, it's the fad thing right now, but
right.
you have to understand it's not for every single individual. You know,
Exactly.
and you
Exactly.
definitely need to talk to an expert like us
Yeah.
in regards to that. So just don't jump on board because the news, you know,
Right.
talking about intermittent fasting and all that,
Mm-hmm.
it will not be the right thing for you.
Exactly.
Yeah,
Exactly.
yeah, absolutely, absolutely.
Mm-hmm.
So, in regards to like medications, I know there's several diabetic medications that help with weight loss, and then
Right.
also weight loss medications. Do you prescribe anything for your pre-diabetic or diabetic weight loss patients?
Some, you know, I tend not to use a lot of medications when it comes to weight loss.
Okay, okay.
I used to. I mean, I've done it. I've done it in the past.
Yep.
And my experience has been that that if patients do not develop
Mm-hmm.
the behavioral component,
Yep.
the medications don't work. I mean, they work. You'll lose weight,
Right.
but you regain the weight back.
Right.
So patients, so they know, don't, so I tend not to prescribe when it
Right.
comes to weight loss.
Yeah.
However, you know, metformin is something that can be used, right? There's
Yep.
also and metformin, as we know, is a medication used for diabetes.
Mm-hmm.
And so, you know, every now and again, I'll have a handful of patients who are on metformin.
Mm-hmm.
And then there's like I don't know if I should really say like the trade name, but people will see it on TV. So I probably could say it, like Saxenda.
Saxenda, yes.
Yeah.
Which is the injection.
Medications
Yeah.
that people can use
Mhm.
that tend to assist with weight loss.
Right. So that's a side effect. It's
Sorry?
no, I'm saying it's a side effect of
It
using.
was right, and that's how it was developed. You
It's a
know,
good side effect. Yeah. So
right. It was a side effect, exactly.
Yeah.
So listen, I have to apologize. My dog is barking in the background,
okay, hi
trying to get my attention. So yes, I'm just going to ignore her.
Right.
That's Coco Chanel. I'm going to ignore her.
It's all good. It's
But
all
yes,
good. Yeah, yeah. And then so for people that are, you know, watching us right now, for your pre-diabetic or diabetic weight loss patients, is there a particular diet that you recommend for them?
well, what I tell them, and you know, it's just a place to start. You know, it's not one size fits all.
Right.
I try to get them really to kind of we want to go with that 5 to 6 small meals a day. So if they can have maybe at breakfast something that's around maybe 300, like 200 to 300 calories.
Okay.
Lunchtime, same thing. But then dinner could be something, you know, more substantial. I do try to have them cut back on the carbohydrates.
Okay.
Right. Because we're trying to lose weight.
Do you have them count their
sorry?
carbohydrates? Do you have them count your carbohydrates or just the calories?
Really, almost really, and not even so much. Really, kind of like the calories, not so much the carbohydrates.
Okay.
And what I'll tell them, let's see, my screen is acting up here. But what I tell them is to let's see.
You're good.
You're good. Okay, you can see.
Yeah,
Okay.
I see you. Yes.
Okay.
Yeah.
So what I tell them is to cut back on the rice, the potatoes, the pasta, the bread.
Yep.
The juice.
Yep.
The sodas.
That's right.
Right. And then I have to remind people, French fries are potatoes. Okay, they always forget that one. French fries are potatoes. And so really, if we can cut back on those carbohydrates, you know, when you have your, you know, your large meal, say your dinner, most people may have it at dinner or sometimes people have it at lunch. So something like you want to have your protein.
Yep.
And then maybe just have some vegetables and salad with it. You don't always have to have that meat and potatoes.
That's right.
That so many of us grew up with.
Right. Right.
And
that's
so what
the problem?
Right. Yeah. So you know, it takes a lot of of undoing some habits, that might be cultural,
Yes.
right?
Yes.
I have to remind people that a
Mhm.
serving, if they do have some carbohydrates like rice,
Mm-hmm.
that the serving is like the size of, your fist.
Mm-hmm.
Whereas we tend to put rice over the whole entire plate, and then we'll put like a little bit of
And heap it. And heap it.
on top,
You heap it.
right?
Right.
So
Yeah.
it comes down to portions.
That's right. That's right.
Mhm,
Exactly. So the comments that are happening, it's very comical. So some people are saying you're crushing them right
Oh
now
no!
with the carbohydrates. And then Dr. Kadisha is saying potatoes and corn on the same plate. Can't happen.
Right. Because here's the thing.
Happen. Yeah.
Now corn. Okay, so now also you want to try to choose vegetables.
That's right.
There are some vegetables that are very, very high glycemic,
Mm-hmm.
right? Or I would say like very high carbohydrate vegetables.
That's right. Mm-hmm.
And corn happens to be one of them. So in that category would be corn, peas, edamame,
Mhm.
Brussels sprouts,
Mm-hmm.
okay, onions. So those are some of the things that I might try to limit
Mm-hmm.
when I'm working towards weight loss.
Mm-hmm. Mm-hmm.
But when you get to a maintenance, a maintenance stage, you
Yeah.
can add those things back.
Right.
But if you're really serious about really looking at losing weight and getting down, those are some things I would limit.
Yep. Absolutely. Absolutely.
Mhm.
Yeah.
Yeah.
So, do you use meal replacements with your to help control the sugars as well?
I do.
Okay.
Yeah. The meal replacements are not for everyone,
Right.
right? But I do like the meal replacements because it's a grab and go thing. We live very busy lives.
Oh my gosh. Tell
You
me about
know, yeah. And so with the meal replacements, it's something that you can just have, and you know the makeup of it, right? You know how many calories it is.
Right.
And I think it just helps. It really helps a lot of people.
That's right. That's right.
Yeah. And if you have a good quality meal replacement that tastes great,
Mm-hmm.
and that does not have a lot of artificial flavoring and
Mm-hmm.
coloring and things like that, it can be
Right.
very, very helpful. It could be a great part
Right.
of a meal plan.
Right. Yep. Yep. Exactly. Yeah, I tend to do a meal replacement in the morning because it's just easier, because you're just going,
Right.
something easier. And then I also recommend that to people that don't like breakfast,
Yeah.
so it's
Yeah.
something, just drink your breakfast and at least
Mhm.
sustain you for the next 2-3 hours as well.
Exactly.
Yeah.
And good thing that you said that.
Yeah.
When we eat, it's really just supposed to sustain us for the next 2 to 3 hours.
That's right.
So it's not like we're gonna eat and then we're not gonna eat again.
Right.
So the portion and what the makeup of the meal is really just to hold you for 2 to 3 hours. You're going to eat again.
Right. Exactly.
Mhm.
That is correct. That's correct.
Yes.
Yeah. So not one meal a day.
Right. Spread it out.
Spread your meals out. Yes.
Spread it out.
Exactly.
You're going to eat again.
Yes.
And when people do that, they're not hungry, because one of the fears is that a lot of patients think, "Oh, I'm going to be so hungry."
Mm-hmm.
But you know what? They quickly find out if they follow this 5 to 6 small meals, eating every 2 to 3 hours.
Yep.
You will not be hungry. You'll be surprised.
That's right. And it takes a good week to get into that routine.
It does. Yeah.
So. And then, even longer for some people to get into that routine. And then your body kind of like, oh, every 2 hours, like, oh, I need to eat, so
Yes.
Yeah. So I think that's a great thing. And also it keeps your metabolism going. So you are burning that fat.
So you're burning fat. Exactly.
Yeah,
so you're burning fat.
Yeah, absolutely. So we have a lot of people here. So thank you guys for joining us this evening. Hopefully we've shared some great not topics, but So we shared some great information, and anyone with any questions about blood sugars and weight loss? Yeah. Okay.
Mm-hmm.
Yeah. So, Dr. Kadisha, hopefully we answered all your questions. So she was interested in intermittent fasting, nutrition versus exercise. Yeah. And some people are like, yes, I love carbs, Laura.
Mm-hmm. But I think once I love carbs too,
Yes.
honestly.
Yes. In
But I think once you get the weight off,
hmm
you can still enjoy these things, but it's all in moderation.
That's right. That's right.
You know.
And especially for me, like in summer, I love ice cream.
Uh-huh.
So I mean, I'm maintaining my weight now. So like, I make
Mm-hmm.
sure my portion size are small.
Right.
So I'm not like gaining all that ice cream to my hips.
Mm-hmm. Yeah. So you can still you can still enjoy things.
Mm-hmm.
But
Exactly.
I mean, for me, I like ice cream, but I like real comfort food. So I'm like a macaroni and cheese type girl.
Oh gosh.
That,
Okay.
but
Yeah.
there's a way to do it.
That's right. That's right. Yeah, they do have some recipes on using cauliflower and
Mhm.
everything
Yeah.
for that. So there are alternatives as well to keep that, the carb lower and everything.
Right.
Mm-hmm.
Yeah.
Yeah. Okay.
Mhm.
All right. So someone has a question about gout. So gout and weight loss.
Gout and weight loss.
Yeah, it's a different type of diet.
Yeah. I think a lot of times if people are having a very high protein diet, so sometimes when you're doing weight loss programs, or using a lot of certain meal replacements, they can be very high in protein.
Yeah.
And so sometimes that may be the trigger for the gout.
And meats and
Meat, yeah.
foods as well can also.
Mhm.
Yeah. So, okay. All right. Any other questions? All right. So, Dr. Vanessa, thank you so much for sharing all the knowledge, on blood sugars and everything. And let's see here. How can we share with us how we can reach you?
Okay, so let me just see if I can fix my screen a little bit.
You're good. Yeah, you're good.
I'm good.
Yeah, you're
good. But I'm not. You know what? I don't really see you well.
Oh, okay.
It's my.
But I see you.
It's that screen.
Yeah, I see you.
Oh, now I'm back. Okay, now I can really see.
Yeah.
Okay. So so Dr. Janine, once again, thank you so much. I mean, I really enjoyed this. It was a great opportunity to be here. I really appreciate it.
Yeah.
And so what I want to tell your viewers is that I would love for them to join my Hello Spring Body Reset challenge. Okay. And so basically, if they're looking to lose weight, to slim down, to get the healthier lifestyle they desire, I have the program that they need.
That's right.
And so they can find me at https://tinyurl.com/hello spring body reset. That's HELLOSPRING BODYRESET.
All right. Yeah. So I have it up on the screen as well.
Thank you. Thank you so much, Dr. Janine.
Yeah. And then on Facebook, she has a group, and this is how you can join her group as well.
Yes.
Okay. All right. So Dr. Vanessa, thank you so much for being here. She's one of my super friends and fellow weight loss experts. She's located in New York, everybody. So if you are in New York, you can also seek her out as well.
Yes.
And then otherwise, join her challenge and also her Facebook group here. Thank you so much for sharing all your knowledge with weight loss. And we're so happy that you guys joined us this evening. Thank you all to our viewers, and hopefully you picked up something that you can add to your daily lifestyle and change your lifestyle for good. Okay, so we're going to sign out now. Thanks again,
Thank
and
you.
and I will be back tomorrow with another weight loss expert. And again, my name is Dr. Janine. I'm a board certified family doctor and weight loss specialist. I help women get their sexy back by providing a medical weight loss program here in Pennsylvania. I do that virtually. And you can reach me at www.lifestylechangesllc.com. All right. So thank you all. I think there's one more comment. Okay. There's several people that said thank you. Thank you, Charlotta. All right.
Thank you.
All righty. So see you guys tomorrow, 6 o'clock. I'll be bringing another weight loss specialist in. We'll be talking about gut health. All right. So stay tuned. Thank you, Dr. Vanessa.
Thank you, Dr. Janine.
Okay.